Hi, my name is Emma Frimpong, and I'm going to be talking about the case study number 14, Should Have Worn Boots. So when it comes to this particular case study, I had a patient named Joe. He's a 53-year-old homeless man who has obvious gangrene in both feet. Upon hospital admission, he had a temperature of 41.7 degrees Celsius, a pulse of 110 beats per minute. His blood pressure was 70/30, and his respiration was 20 breaths per minute. When it comes to his symptoms, he had a stiff neck. Blackened areas were present in both of his feet, including his heels and his toes. Neurologically, the patient responded to deep pain with grimace, and the patient also later on had a seizure and was treated for that. He also had opisthothonic posturing, and an increasing rigor developed. He also had great respiratory distress, and he was unresponsive at times. So the suspected syndrome that I suspect in my patient is meningitis, and then the obvious gangrene that was mentioned earlier. Again, his symptoms was a fever, a stiff neck, and a stiff back, increasing respiratory and heart rate, and he also had rashes and skin irritation upon his body. So when it comes to the bacteria, gangrene is caused by two gram-positive bacteria, and it's called Clostridium perfringens. Meningitis is also caused by two gram-negative bacteria species called Neisseria meningitidis and Haemophilus influenzae. This syndrome is also caused by one gram-positive bacteria named Streptococcus pneumoniae. I don't suspect any viruses in the patient. I also don't suspect any fungus in the patient. I do suspect some parasites in the patient, only because gangrene and meningitis are caused by these listed parasites that I have here. But I mainly suspect bacteria, gram-positive bacteria, in my patient. So when it comes to the sample request form, I asked for a blood smear, cerebrospinal fluid, and also a wound specimen. When it came to the blood, it was drawn with a needle and syringe. 5 milliliters was drawn from the patient, and this specimen was also refrigerated at 2 to 6 degrees, along with the cerebrospinal fluid, which was done through a spinal tab, and 5 milliliters of cerebrospinal fluid was drawn from the patient. Like I said, it was also kept in a refrigerated storage, and I also asked for a wound specimen to detect any bacteria that I suspected, which was the Clostridium perfringens and the Streptococcus pneumonia. So these are the lab results regarding the cerebrospinal fluid. There was no growth of bacteria seen in the cerebrospinal fluid, and there was also no growth on any of the media. Also, when it comes to the wound specimen, there was gram-positive bacilli growth in the blood smear, and there was no growth in the other media, but there was growth with hemolysis after 48 hours of incubation. When it came to the blood specimen, there was no growth in any of these media. So after looking at these results, I can say that a specific type of bacteria is infecting my patient, and it's coming out of the wound specimen. So this is the lab results from the serology lab, and basically this lab result shows that the wound fluid is greater than 0.9, which equals positive for Clostridium perfringens, which is one of the suspected gram-positive bacteria that I was talking about in question 2. And finally, question 8, the prognosis and treatment. When it came to the prognosis, I believe that the patient is in a preferable condition to undergo treatment. And I considered his age and his medical history, and I found that it's fine for him to do any surgical procedure, and it's fine for him to be medicated with antibiotics. So when it comes to treatment, I would treat the patient with antibiotics in order to kill any bacteria in the infected area, and also surgery will be done to remove any of the dead tissue that is in the affected area.